Hello, this is Sarb Lally from the British Columbia Teachers Federation, and thank you for joining me for this mini seminar on the extended health and dental benefits for retirees that are available to teachers who retire in British Columbia. Today is December 14, 2023, and hopefully the information that I share is up to date to today's date. I'd like to acknowledge that I'm coming to you live from the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples, and I'm grateful for the opportunity to make this presentation. All right, so my objective today is to compare the retiree extended health and dental group benefit plans that are available from Green Shield Canada, which is through the Teachers Pension Plan, Johnson Insurance, which is through the BC Retired Teachers Association, and Entente Insurance, which is through the Retired Teachers of Ontario. When you retire, any extended healthcare or dental coverage through your employer will stop. As you age, your health may decline and medical bills may increase. Fortunately, insurance options are available for your extended health and dental coverage needs, and we're going to go through three of those extended health and dental carrier options that are available to you. Now, please note there are other insurance companies out there that are able to provide you with extended healthcare and dental coverage, and I encourage members to shop around. I'm not going to be recommending one company or another company to you. I'm simply going to be presenting you information on your options that are available. To that end, I have this handy dandy disclaimer. The information provided by the BCTF in this webinar is for general informational purposes only. All information provided in this webinar is provided in good faith. However, we make no representation or warranty of any kind, express or implied, regarding the accuracy, adequacy, validity, reliability, availability, or completeness of any information in this webinar. So, in plain language, we take no responsibility for any mistakes, errors, or omissions. And I'm going to be providing highlights only that have been chosen by me from these three different plans that would make an easy comparison. For complete details of each plan's coverage and eligibility criteria, please go to that plan's website and review the information that's available on that plan. And at the end of this presentation, I will be giving you the website information where you can go and look up all the information that you need about these three extended health and dental benefit plans. Okay, first of all, let's learn a little bit about the Green Shield Canada plan. So with the Green Shield Canada plan, you may apply for extended healthcare and dental coverage with Green Shield Canada when you apply for your pension. In fact, the application for the benefits is part of the retirement application package, which comes to you from the Teacher's Pension Plan, because the Green Shield Canada plan is the preferred insurance carrier of the Teacher's Pension Plan. Now, if you do not enroll when you apply for your pension, you can only enroll later in the Green Shield Canada plan if you have had continuous coverage in a different extended healthcare and or dental plan since your retirement date. If you cancel your coverage, you cannot re-enroll in the plan unless you've had continuous coverage in a different plan. Also note that more than 28,000 retirees are covered by the Green Shield Canada plan. Now, the Johnson Insurance Plan is through the BC Retired Teachers Association, the BCRTA. For this plan, BCRTA members in good standing may apply for extended healthcare coverage within 60 days of terminating group insurance coverage without having to submit medical evidence for eligibility. You must provide proof of enrollment in the BC Fair Pharmacare plan in order to be covered under the BCRTA plan. Your premiums will be deducted from your bank account each month. This is different from the Green Shield Canada plan, where the Teacher's Pension Plan will deduct the Green Shield Canada plan premium from your pension check before they put the pension check into your bank account. So there's one extra step required, when you're a member of the Johnson Insurance Plan. But it's still fairly simple as your premium gets deducted from your bank account each month and you don't have to worry about it. Now, please note that for the BCRTA, there is a yearly membership fee starting on January 1 of 2024 of $58 per year. The Retired Teachers of Ontario plan. Well, the Retired Teachers of Ontario is a bilingual organization with 82,000 plus members in 51 districts across Canada. They have a yearly membership fee of $73 for retirees. And Retired Teachers of Ontario members in good standing may apply for extended healthcare coverage within 60 days of terminating their group insurance coverage without having to submit medical evidence for eligibility. If you're a late applicant, you will have to provide evidence of insurability. And also note, the dental plan has guaranteed acceptance. Let's take a look at lifetime maximums and co-insurance from the three plans. For Green Shield Canada, they have a $200,000 lifetime maximum. Now, you and your dependents will continue to be covered even if you reach your lifetime maximum above. You'll have to continue payment of rates for your dependents only because you won't be eligible for reimbursement for any of your own health claims, just your dependents. Their co-insurance level is 80%. So they cover 80% of your claims on eligible expenses up to $1,000 per person. After a person has reached $1,000 worth of eligible expenses, then they'll receive 100% coverage of any further expenses beyond the $1,000 mark. Please note, if you shop at Costco and you obtain your prescriptions there, you'll receive 90% coverage for your prescriptions at Costco. Under the Johnson Insurance Plan, they have a $250,000 maximum per lifetime for combined eligible drug and non-drug expenses per insured person. And their co-insurance level is also 80% of eligible expenses. For Entente insurance, there is no lifetime maximum as to how much you can spend on extended health care coverage. And their co-insurance level is 85%. And that's up to a maximum drug cost of $3,400 per person per year. If you shop for your prescriptions through the Express Scripts Canada Pharmacy, you'll receive 100% coverage if you're purchasing generic drugs and 90% reimbursement for brand name drugs that you purchase through the Express Scripts Canada Pharmacy. And then co-insurance on all other items is at 80%, unless it's specifically excluded from co-insurance. How about deductibles? Well, Green Shield Canada has a $200 deductible on your extended health care. That's excluding the auto injector, insulin gun, insulin pen injector, hearing care, and vision. Those items don't have deductible before Green Shield Canada starts paying. Now, if in any calendar year the deductible is not satisfied, claims incurred in the last 3 months of the calendar year may be used to satisfy the deductible in the following year. For Johnson Insurance, no deductible. For Entente Insurance, also no deductible. And please note, through Fair Pharmacare, if there are deductibles, then Johnson Insurance will cover 85% of the cost of the deductible, or of the drug ingredient costs up to that deductible limit. Now, let's talk about prescription drug coverage. So Green Shield Canada has a mandatory generic plan. So what they do is they cover you for the costs of the generic drug that's going to do the job for the medical condition that you have. So these drugs have to have a prescription from your doctor, and they also have to have a drug identification number in order to be covered. And coverage is subject to the overall health maximum of $200,000. They will cover up to an 8% markup on drugs. If there's a markup on the cost of the drugs that's more than 8%, they won't cover the amount above the 8%. And they also cover up to a $10 dispensing fee. Anything above $10 will not be covered. For Johnson Insurance, they cover prescription drugs that are included in Pharmacare, and those drugs are subject to the Pharmacare low-cost alternative and reference drug program pricing, so which is similar to the mandatory generic plan that Green Shield Canada has. They also have $10 dispensing fee cap, and they only cover up to an 8% markup, just like Green Shield Canada. And their drug claim maximums are $2,000 for Plan A in any year and $4,000 coverage for Plan B in any year. They also cover vaccines up to $100 per calendar year. Entente Insurance gives you 85% coverage up to $3,400 worth of drug coverage in a year. And their coverage is based on the price of the lowest cost interchangeable drug which can legally be used to fill a prescription. That's similar to the mandatory generic plan of Green Shield Canada. Maximum drug supply is 100 days. For extended vacations, a further 100 days can be obtained. Now, let's talk about Fair Pharmacare and how that comes in to help you pay for your drug costs. Because we noted earlier, Johnson Insurance has a $2,000 and a $4,000 drug plan, and Entente Insurance has a $3,400 drug plan. So how do you pay for drugs that, over the course of the year are going to cost more than $4,000, $5,000, $10,000, $20,000? Well, here's where Fair Pharmacare steps in. All BC residents with MSP coverage are eligible, and Fair Pharmacare will cover your prescription drugs if they're in the Fair Pharmacare formulary. They'll cover medical devices and also pharmacy services. The assistance levels are based on your family income levels. So they'll provide 70% coverage of eligible costs after you've met your family deductible, and they'll also cover 100% of your eligible costs after you've met the family maximum. So on to the next screen, where we take a look at what some family deductibles can look like and what some family maximums can look like. So here are some examples that I've chosen from the BC government web page related to Fair Pharmacare. So you can go onto the BC government web page, type in Fair Pharmacare assistance levels, and it'll eventually take you to a page which has all of the various income levels and the family deductibles that go with each income level and the family maximum that goes with each income level. I've taken 5 levels out of that table that's available on the web page and put them into this slide. So note that anyone who has an income that's under $15,000 or up to $15,000, you have no family deductible that you have to meet before Fair Pharmacare will start covering your drug costs. And note that the family maximum is only $100. So if you have drug costs that are between $0 and $100, Fair Pharmacare will pay 70% of those costs. So you'll be out of pocket $30. And then if you have drug costs in a year that are over $100, then anything over $100 is fully covered 100% by Fair Pharmacare. So all you're going to pay out of your own pocket is $30 to meet that initial family maximum of 100. Then everything's paid for. For someone who has an income between, say, $28,750 and $30,000, you still don't have a family deductible. So all of your drug coverage costs will be covered up to $800 at 70% coverage. And anything that you pay that's above $800 during the year, that'll be 100% covered. So once you reach that $800 mark, any drug costs beyond $800 are 100% covered by Fair Pharmacare. Now let's go all the way to the last income level on this slide. So say you have an income that's between about $96,000 and $108,000. You'll have a family deductible of $3,000. So this is where your benefit plan really comes into play. So that family deductible of $3,000, you have to pay that $3,000 out of pocket. So you would submit those claims to your group insurance provider, like Green Shield Canada, Johnson Insurance, or Entente Insurance. And they would provide you coverage for up to $3,000. Then anything between $3,000 and $4,000, you'd receive 70% coverage from Fair Pharmacare, and the remainder you could apply for coverage through your group insurance provider. And once you reach $4,000 in drug costs in a year, then it's 100% covered by Fair Pharmacare. So that's how Fair Pharmacare works, and that's how it would work in conjunction with one of your group insurance plans, either through Green Shield, Johnson, or the Retired Teachers of Ontario, the Entente Insurance Plan. Now let's move to vision coverage. With Green Shield Canada, you have $300 coverage every 2 calendar years, and every calendar year for dependent children. And that covers eyeglasses, contact lenses, or eye exams. For Johnson Insurance, you also have $300 every 2 calendar years, plus up to $100 towards one eye exam every 2 calendar years. And they also cover visual training that's not covered by the provincial health plan. Entente Insurance gives you $400 coverage per insured person in any 2 consecutive calendar years for prescription eyewear, including fitting fees, laser eye surgery, and corneal incision. Another $50 yearly limit for any visual training or remedial exercises not covered by MSP. Another additional lifetime limit of $400 if you need new lenses within 6 months of having eye surgery. So you can think about, say, cataract surgery, for example. There's a limit of $400 in any 2 consecutive calendar years for contact lenses for specific eye conditions. And then $150 for eye exams in any 2 consecutive calendar years. On to paramedical practitioners. So Green Shield Canada gives you a $1,000 limit every year for all of those practitioners on your screen combined. So it's not $1,000, for an acupuncturist, another $1,000 for a chiropractor, another $1,000 for a registered massage therapist. No, it's all of them combined. $1,000 is the limit that they'll cover up to at 80% coverage. Johnson Insurance also has a $1,000 limit, but they have a little bit larger list of paramedical practitioners that they will cover. Entente Insurance has a $1,300 combined per calendar year limit, and they have an even longer list of paramedical practitioners that they'll provide coverage for. Hospital stays. With Green Shield Canada, you can have a semi-private or private room covered based on their reasonable and customary charges. With Johnson Insurance, you have 100% reimbursement up to $100 per day for private or semi-private accommodation. Please note the Green Shield Canada coverage is 80%. That's their co-insurance level. For Entente Insurance, there's a 95% reimbursement of the daily semi-private room rate while you're receiving active acute care in a hospital. How about hearing care? Well, Green Shield Canada provides you 100% reimbursement to a limit of $1,400 every 4 calendar years for hearing aids, repairs, or replacement parts, excluding batteries. Johnson Insurance provides you with 80% reimbursement on the purchase of hearing aids to a limit of $1,400 per 4 consecutive calendar years. And the RTO's Entente Insurance provides you with 80% reimbursement on a purchase or repair of hearing aids, excluding batteries, to a limit of $1,100 per insured in any 3 calendar years. How about private duty nursing? Well, Green Shield Canada provides you $50 per day to a maximum of $10 or to a maximum of 10 days per medical event following a hospital stay. Johnson Insurance gives you 80% reimbursement to a maximum of $3,000 per 3 consecutive calendar years. And Entente Insurance provides you with 80% reimbursement to a maximum of $2,000 per insured person in any 2 consecutive calendar years. Home care. With Green Shield Canada, it's not offered separately from your private duty nursing. So the same amount that you have for private duty nursing is what's covered for home care. Johnson Insurance gives you extra insurance for home care. It's $50 per day, the maximum of 10 days following a hospital stay. Entente Insurance provides you with the greatest benefit, 80% reimbursement to a maximum of $75 per day for a maximum of 30 days following a hospital stay and a maximum of 3 days after non-elective day surgery. Under the category of orthotics or orthopedic footwear, Green Shield Canada has coverage for $400 every calendar year combined. Johnson Insurance gives you $500 per 3 calendar years for orthopedic shoes and $300 per 3 calendar years for orthotics. Entente Insurance gives you $500 every 2 consecutive calendar years combined. Now let's talk about dental coverage. First, with enrollment. With Green Shield Canada, you can enroll no later than 60 days upon pension approval or 60 days of losing continuous coverage. With Johnson Insurance, you can enroll on, before, or within 60 days of becoming a BC RTA member and termination of previous group insurance. With Entente Insurance, you may enroll within 60 days from the termination date of your group plan, or you're considered a late applicant and required to maintain coverage for 24 months. So talking about maintaining coverage, that's the lock-in requirement. The Green Shield Canada lock-in requirement is a minimum of 12 months coverage. And if you want to upgrade to enhanced dental, you have to stay with their essential dental plan for 24 months before you can upgrade to the enhanced dental. And for Johnson Insurance, they have a lock-in of 24 months from the effective date of your dental coverage. Now let's take a look at the actual benefits. So for basic and minor services, Green Shield Canada, under their essential dental plan, provides you with 70% to $1,000 maximum per year. The enhanced dental plan provides you with 70% to $2,000 maximum, which also includes their comprehensive and major services. For Johnson Insurance, you have 80% coverage, which includes one standard exam, a recall exam, and polishing every year. And $750 is the yearly maximum for minor restorative services. Entente Insurance provides you with 85% coverage, which includes one standard exam and polishing every 9 months, and $800 yearly coverage for minor restorative services at 80% coinsurance. Now, for major services, that coverage under Green Shield Canada's plan, it's the same as the previous slide, they have a $2,000 maximum with 70% coinsurance, and that includes both the comprehensive and major services. With Johnson Insurance and Entente Insurance, they have separate amounts for major services. So both of them provide 50% reimbursement. With Johnson Insurance, it's up to $700 yearly maximum for crown, posts, onlays, and inlays, whereas Entente Insurance has an $800 maximum for that benefit. And Johnson Insurance has a $700 yearly maximum for bridges and dentures, whereas Entente Insurance provides you with $800 yearly maximum for that benefit. Now let's take a look at the monthly premiums for each company. So first, with Green Shield Canada, here are the prices for single coverage, couples coverage, and family coverage for the dental and extended healthcare plans. Please note that the dental is broken up into two different plans. There's the basic plan, also called essential, and the enhanced plan. And remember, the enhanced plan has the extra coverage for their major services. Here are the premiums for the Johnson Insurance plan. Notice that there's only one plan for dental. And for extended healthcare, they have two separate plans, a $2,000 drug maximum plan and a $4,000 drug maximum plan. So if you typically spend a lot on your prescriptions, then you would most likely go with the $4,000 drug maximum plan. And remember, anything above those maximums is mostly covered, if not totally covered, by Fair Pharmacare through British Columbia. Here are the monthly premiums for Entente Insurance, and these are as of October 15, 2023. I should have mentioned that the Johnson Insurance premiums were effective September 1, 2022, and the Green Shield ones were effective February 1, 2023. So, but with these premiums with Entente Insurance, I want you to notice that there's a third column there for hospital and convalescence. So whereas with the Green Shield and the Johnson Insurance, the hospital coverage was part of the extended healthcare premiums, Entente Insurance has separated the hospital convalescence premiums out from the extended healthcare coverage. Now moving on to optional medical travel coverage. So each company provides travel coverage that'll cover you for medical emergencies. Please contact each company's representatives for more information. If you want to see the full benefits plan documents for each company, on the slide in front of you now, you can see the website addresses for the Green Shield Canada booklet, which is available on the Teacher's Pension Plan website. There's also the certificate of insurance for the BCRTA plan through Johnson. That's available on the Johnson Insurance website. And on the RTO website, you can see the link to the insurance plans that are available on their website. Here's some contact information for the various insurance companies. Green Shield Canada at the top, followed by Johnson Insurance and Entente Insurance, the three group benefits providers that I've discussed today. I've also provided telephone contact information for Pacific Blue Cross, Manulife, and Canada Life. You can also find information on the web from Sun Life, as well as Desjardins, and other insurance companies. Please note that the BCTF doesn't recommend one company over another. We encourage you to call each company, shop around, and ask them about their premiums, about their coverages, and find the fit that is best for you and your family. That's the most important thing. Now, I did want to bring to your attention that the teacher's pension plan is trying to find a balance between the cost of premiums and the coverage provided through their Green Shield Canada plan. There's some complications that have been noted through the survey recently done by the teacher's pension plan and the experience over the last few years. Notably, that costs are increasing, particularly for prescription drugs. Members are taking more medications, and most new drugs coming to the market are more costly than the current drugs that treat the same condition. The teacher's pension plan wants to hear from you with respect to the extended health and dental benefits that are available from the teacher's pension plan. So here are 3 ways to contact them: via email, telephone, and fax. And you'll see the appropriate contact information on the slide in front of you now. And if you want to talk to me, you can see my email address, slally@bctf.ca, as well as my direct phone number, 604-871-1949, as well as the toll-free number that you can call from anywhere in North America. So that brings me to the end of my presentation. Remember, if you have any questions or if something wasn't clear in the presentation, please feel free to email me or call me, and I'll be happy to have a conversation with you one-on-one and hopefully clear up any questions or concerns that you may have. Thank you for attending today's session, and have a great rest of your day. Please note that I have a number of other mini seminars and full seminars, FAQs on the BCTF YouTube channel. Please go to the BCTF YouTube channel. So in YouTube, type in BCTF videos, click on the BCTF icon, and then click on playlists, and you can click on the full pensions playlist, and you can find a number of videos on a number of pension-related topics that hopefully you'll find interesting. Thank you very much for attending today's session. Goodbye.